Good. Okay, then I'm going to turn this over to Jim Fusco, who I have made co-host. He is our speaker for this evening. He's with the Yale New Haven Health System. He's also a member of ASCM New Haven, and he's a CPIM. Jim, take it away. And by the way, yes, thank you. We are recording. And so if you don't want to be seen, turn off your camera. If you don't want to be heard, mute yourself. And if you do not want to have your name shown, rename yourself.
Yeah, I promise this will be a session you won't mind having your name attached to. Thank you for having me. I used to be a lot more involved before kids came around in APICS, and just a little bit of, well, first of all, here's our mission, vision, values here at Yale New Haven Health. For those who aren't familiar with the health system, we have 6 delivery networks throughout the state and into New York and Massachusetts and Rhode Island. And we've got 6 major hospital sites, in addition to almost 300 outpatient facilities throughout that whole area. We're an organization of 30,000 people at this point, and we have obviously a very important job to do here in supply chain. So let's get to it. So my name is Jim Fusco, and as John mentioned, I do have my CPIM. I'm also certified in healthcare supply chain with my CMRP, and got my MBA last year from Southern Connecticut State University. I've been at Yale New Haven for going on 6 years now. Prior to that, I worked at Perricone MD Cosmeceuticals for 7 years, where I started in supply chain. So it's been a great ride. My time with APICS has been really fantastic, and I credit my success so far to my certification by far and away. And it's taken me to places I never thought possible. When I got my certification, I submitted a presentation and got to speak at the APICS National Conference in New Orleans. And then when I was there at that conference, someone walked up to me after my presentation and said, you do a really good job at our national conference. It's like, what are you talking about? And it turns out he was from South Africa, and I was then invited to speak at the SAPICS conference in South Africa, which was just the best. I had such a great time, and got to sit next to the APICS US CEO at the time, and just really opened up a lot of doors for me. So wanted to talk to you all today about my experiences here at Yale New Haven Health over the past 14, 15 months. It's been a whirlwind of a time. I don't think I'm necessarily going to be teaching anybody anything, because there's a lot of folks who are professionals with a lot longer tenures than I've had. But it was a pretty unique time, and we got through it very successfully, and thought that sharing this story would be really great. I also have a slightly ulterior motive for wanting to speak, is how I got in touch with John. I'm also in charge of the select talent group for our talent management in supply chain at Yale New Haven Health. And one of the things that I've been charged to do is to create a pipeline of folks that we can get to apply to open positions at Yale New Haven. So like, for instance, right now I've got an entry-level buyer position open, likely not the cup of tea for most folks on this call. But if you do know somebody that might be interested, that it's looking for a supply chain career, please get in touch with me. And, but same thing, I want to make sure that this is a good pipeline for Yale New Haven to work with APICS, an organization I've just had so much success with, to just really have communication around what's opening, where there might be opportunities, and to get folks into the organization, that bring a different perspective. And I know that I was brought into Yale New Haven Health because of my APICS certification, because they wanted to bring in, apex. They wanted to bring in supply chain experience from a different perspective. Hospital supply chain doesn't have the greatest, you know, what's the word I'm looking for? Reputation for being a forward thinking. And I think that kind of brings us into the start of the presentation here. And John, I hope it's okay. I keep seeing these things about admitting people to the meeting, and I'm admitting them. So I hope that's okay.
I'm taking care of that, Jim. I also just
Okay.
posted a note that said anybody who's interested in something with you to send their resume to me, and I'll get it to you.
Great, thank you so much. And so, and my position at Yale New Haven, I'm a supply chain manager that is current. I used to be the manager of procurement operations, which was a centralized procurement group for our entire health system, which represented $4 billion in spend each year. Under me was a pharmacy procurement that we spend $500 million a year on. Just to get kind of some of the scale, it's a pretty massive organization, and was lucky enough to run that department for about 4 years. And then now I've transitioned into running, thankfully for my health, a much smaller smaller group that's over capital procurement and facilities projects. So we're really excited. Our next big project is to do the contracting and procurement for the St. Raphael's Tower, which is starting very soon. Supposed to start sooner than this if it wasn't for the pandemic. But that's a nearly $1 billion building, neurosciences bed tower that is going up where the current St. Raphael's campus is. So really exciting stuff. And, you know, I can't say enough about working at Yale New Haven. It's a really good place to work. So moving on. And please, you know, if anybody has any questions, stop me if I'm rambling too long or if I gloss over something too quickly, just let me know. Okay, so background. What was the state of supply chain at the health system prior to March of 2020? And the best way to really describe it is by talking a little less about supply chain and talking more about the organization. The organization of Yale New Haven Health has traditionally made money without really having to try too hard. And that's the best way I can kind of put it. The organization has consistently turned a profit that, you know, because they're not for profit, has reinvested into the organization every year for the past 50 years. Until March 2020 came around and everything was shut down. And when I say everything, I mean all of the elective surgeries, all of the real money makers for the health system were all completely shut down for 3 months. So prior to that, the health system really didn't have any financial issues, never really had to worry about it. And while supply chain was always tasked with trying to save money and get better contracts, better pricing, it was, at least, and this is just my opinion, it was more of a nice to have instead of a necessity. The organization was always trying to do the best that it could with the money, but it's kind of like anything else, right? I mean, you know, we all try to be frugal in our daily lives, but I bet we'd be a heck of a lot more frugal if we lost our source of income. And I think that's kind of the state of the organization prior to March of 2020. One of the things that we had done, and we didn't realize it, but, you know, kind of put a pin in this about what this meant to us later on. But we built a regional operations center building in West Haven, right over the New Haven line. And this building, it was a relatively small warehouse, about 65,000 square feet, plus some office space, that was put there to be a hub for our major medical surgical products distributor to run and then distribute the products to our facilities. Kind of like just a hub for us to have our products distributed from our own spot, so that it would kind of increase some of the efficiencies, cut down on some of the time. This building was slated to be open in April of 2020. So the building had been built, it was empty, and was ready to go. It just needed some contractual things right at the last minute, and everybody was going to start, you know, moving things in and really just, you know, making this a real working warehouse. So that's kind of setting the stage for when the pandemic hit. And then we also have had some people don't kind of really think about it, but we've had some mini pandemics kind of crop up in the past. There was the Ebola scare. There were some others like bird flu and swine flu and so on, and SARS that have come up that obviously didn't get to the levels, thank God, of what we've been going through over the past year or so. But we did have a small warehouse space underneath the main building at Yale New Haven Hospital in downtown New Haven that housed our kind of like excess supplies, but also had a small area for pandemic supplies. But it wasn't anything that could really get you through. It would just kind of, the idea was that you had enough to allow you to place some orders and allow those orders to come in. And so when we started to realize that this was becoming a thing, when the pandemic was becoming a pandemic, we started to notice that our normal distribution levels were not going to cut it. And there's a lot of reasons. One, we would always run what they call it a just-in-time program, but that's not what it is. It's a just-in-time program that has a backup inventory, which I call a just-in-case program. And basically the idea there is that because we run a hospital and can't really run out of things, we try for efficiency to do and costs and such. And we don't have a lot of space in our downtown hospital areas because any space that's used for storage is not money-making space. If you turn that space into medical use space, well, then you can make money with it. So the storerooms are minuscule at best. And so we would have our normal just-in-time operation going, but with a small inventory off to the side for those just-in-case type of moments. But then when I'll save the distribution piece for a little bit later, because I think the state of where we were with distribution is kind of important to once the pandemic started. So we'll save that. And I think one thing that kind of gave us a little bit of a heads up as to where this was all going was when the hurricanes and earthquakes in Puerto Rico happened a couple of years ago. I don't know if folks on this call would know this, but down in Puerto Rico, it's the only place anywhere close to the Americas that IV solutions are produced. And on the grid that was, the power grid that was obviously running on its last legs and failed very easily and couldn't be started up for months, we ran out of IV solutions. And when you run out of IV solutions, I talked to a nurse who had been working at Yale New Haven for nearly 40 years. I said, well, what do you do when that happens? And she said, you don't do anything and people die. And so when that happened, it really was a wake-up call, I think, to the health system to say, wow, our vendors put their eggs in one basket. And this is something that is really potentially disastrous for the future, because we didn't have a way of getting these products in. And when you think about it, if you're a vendor, you're really going to go it's like building your factory on a tectonic fault. It's not a great idea, and really something that should have been contemplated a little bit more. But the health system, or healthcare in general, didn't really realize this until the disaster happened. And then it was just total madness to try to find IV solutions from that point on until the supply got back to normal again. And so again, just this whole part here is just to kind of set the stage for when those first cases started happening. All right. Any questions before I move on, just in case? All right. So immediate response to the pandemic outbreak. We all remember what happened. It really started in earnest in New York, in Westchester County. It was so bad there, and it just radiated outward. So places in northern New Jersey got hit, and then southern Connecticut got hit really bad through Fairfield County, where we have Greenwich Hospital, up through Bridgeport, where we had Bridgeport Hospital, and so on and so forth, just radiated out, almost like a bomb hit, and then it just kept spreading from there. And we rushed to shut down all of our services. Like I mentioned, they were all shut down for 3 months. But I think the other thing to keep in mind as we go through this is, like, think back when dealing with the pandemic, how little everyone knew. When this was first out, it was called the novel coronavirus. Everybody used that term, novel coronavirus, because it was new and people didn't know how to deal with it. I mean, you might remember that when the pandemic first started, everyone was convinced that the only way the virus transmitted was by touch, by your hands. So you couldn't touch your eyes. You had to wash your hands and Purell every 2 seconds. But I know, because I was there, we didn't wear masks for longer than we should have. That took a little longer to kind of kick in. And there's a lot of reasons for it, which we won't get into here. But I think just the idea that this was an evolving thing, and what we know now to be true, we didn't know back then. And so one of the things that I like to point out is that while everyone else was home, everyone else was sent home. People were sent home from schools, and they were all shut down for the rest of the year. People were sent home from businesses, and stores were shut down temporarily. Just, everything kind of just halted. But we in supply chain went in every single day. We had to, because we were the only lifeline, and it was a crazy time. You threw out your normal everyday, here's what I do for a living, and you took on a new persona. I walked right back in to be a procurement manager at that point. And what we did was we had to rush and have to get everybody was put on a different category to go find personal protective equipment or ventilators or beds. We really didn't know how much we were going to need, other than the projections that were sent our way. Now, thankfully, the projections in Connecticut never got to the peaks that were the actual numbers never got to the peaks of the projections in Connecticut, because, frankly, Connecticut really, clamped down hard, especially in the early days, and things didn't get as bad as they could have gotten. When we had this new demand, and I think that's the main thing that was the hardest part for us. We never really had to deal with a situation where we had personal protective equipment used outside of a very specific surgical setting. And now, not only did you had two things that were at play. One was that every single thing you did and every single person had to use personal protective equipment. So you went from maybe 1% of the population of the health system had to use it to 100%. And then you had the usage of that personal protective equipment multiply by an unbelievable amount. All the nurses, the estimates were that nursing and physician staff were using up to 60 N95 respirator masks per day in the early parts of the pandemic. 60. Now, the reason for that was, again, not a lot was known. No one knew how deadly this thing was. No one knew exactly how it was spreading, how long it would last on surfaces, how easily things could be cleaned. I mean, no one knew anything. It was just a completely foreign idea, and everybody was kind of learning as time went on. So when it came to using these N95 masks, they would basically walk in, see a patient, whether they knew had COVID or not, because, again, testing didn't exist at that time in the way it is now. It took weeks to get a test result back, and they would take it and instantly throw it away. So they were going through these things at an unbelievable clip, and every single nurse and every single doctor had to be doing this. And when we did this mad dash, there was obviously some other factors at play, which we'll get into in terms of price and everything, that made this such an unbelievable undertaking to go through. But, we were trying to find things that you couldn't find in the marketplace at all. And I'll never forget the day that someone came into my office and said, Greenwich Hospital is out of body bags and there's no place to buy them. And so your team has to go and try to find them, source them from somewhere, anywhere. And we also need to go and source refrigerated trucks so that we can store bodies in them. And I think when you get someone coming into your office and telling you that, and again, think of the mindset at the time. I mean, the mindset now is, okay, it's kind of winding down and everything's, looking a little rosier than it did yesterday. And today in Connecticut, at least, is the first day you can kind of go wherever you want to go without a mask and all that. But at that time, when you see the projections going like this, you don't know what this virus is and what it's going to do and who it's going to affect. It really does kind of do something to you. And it's one of the reasons why I ended up at Yale New Haven Health is that, I used to work for a for-profit company, and my work made a lot of money for someone whose name isn't Jim Fusco. But now, at least with this job here, the work that we do actually is helping. And I do feel like we were very successful in that. So getting back to our mad dash. So we had a mad dash to secure beds. There were no beds available. We were opening field hospitals. We were converting all of our normal units to intensive care units, which require a different bed, different air handling. We had to go and find negative air pressure units. We were buying them from Home Depot, from wherever you can find them. And ventilators, forget it. Once those were gone, you had a 6-month lead time, because and I think it really does reflect on the state of the supply chain, the global supply chain. I mean, look what happened when that one gigantic ship blocked up the canal over in Egypt. It's like everything ground to a halt for a little while, because, and it's great. We always harp on that. We want to try to reduce inventory and be as lean as humanly possible with our inventory levels. And that's great. That really helps you get a healthy bottom line. But I think as we go through this presentation here, I want everybody to kind of understand that that should be done in moderation, depending on which business you're in and how important it is for you to have those things. So if it's important for you as a publicly traded company to make as much money for your shareholders as possible, and you're making an item that's of very little consequence to the world, like a Frisbee manufacturer or something like that, okay, maybe you keep your inventory low, and if a freighter from China capsizes, no one's dying because their Frisbee didn't show up. In healthcare, I think there's some other considerations to be made, and I'm not necessarily trying to be prescriptive here with this presentation, but just kind of sharing what some of the downstream effects of being a little too lean sometimes are. So moving on, what we had to do was we had to get creative. And this is where having a great team of folks who were being very innovative and very outgoing, just to try to pound the pavement wherever they could to find things, was very helpful. So we worked with new vendors to source personal protective equipment and to produce it. I worked with Sikorsky because their plant was shut down. They didn't have anything going on. So they said, hey, these guys are bored. They want to do something. We've got a whole bunch of plastics. Can we make you guys face shields? And so we worked with them on specs, came up with a prototype, and then had them produce them. I worked with a place called Gilman that was a fabric company, and they contacted us. We worked with them on producing gowns because gowns were impossible to find. And again, if you're a nurse, you're not going to be walking in with your scrubs or your plain clothes on. You want a gown because you don't know if this COVID is attaching to you, and if even by taking it off of you, you're going to get it. And you certainly don't want to be walking around with it in the hospital. So we needed a huge amount of protective gowns. And then, like I mentioned on the presentation, many had never produced these items before, but they were coming out of the woodwork. And mostly because they wanted to help. They had people that they didn't want to lay off because but their plants weren't running. And this was a way for them to kind of give back, get their people working again, albeit on a smaller scale. But it really did help us out, and it was a major factor in our success. We also worked with donors from around the world. There was the most major donor was a former Yale University student who was from China and went back to China and actually opened a hospital out there. And when all this started happening, she donated an unbelievable amount of personal protective equipment that she had contracted and made in China and then shipped over to us. It took a lot longer than it should have to come in, because the ports were tough because there wasn't as many people working. The ports were all backed up. There were embargoes on things coming in from overseas. Problem is that everything is made overseas. There's not that many places to make them in the United States. And the ones that were making them in the United States, the demand was so high, you'd never be able to get enough from there. So your only option was to go out of the country and, for like N95 masks. And then as soon as you'd ship them in, well, the government had first crack at it, basically. And they'd go, ooh, a whole container full of N95 masks. We need that. And so you're out of luck at that point. What we did was, and we also worked with donors, by the way, that were local. So we set up a donation center, and we're able to take in donations from everybody. If it was a person who bought a bunch of respirator masks that they were a woodworker at home or something like that, and they had a box of them in their basement, they'd bring them up and donate them. Surgical gloves, because people buy these things for all various reasons, crafts and things like that. They would donate all of these things, anything that they had, that they could. Businesses would donate a lot of these things if they just had a few boxes sitting around in their storeroom, and it was really useful. Obviously it was a lot of work trying to cull through what could be used, what couldn't be used. If things weren't sterile anymore, obviously that's not really going to help us. But it really was great to see the outpouring of support. So here's where the story takes a turn for the fortunate. And remember that warehouse that I mentioned that was supposed to open in April of 2020? Well, it didn't. Spoiler alert, it didn't. And what's more is that it was still an empty, brand new warehouse building, 65,000 square feet of just absolute empty warehouse space that we owned and had full access to at all times. So what did we do? We ordered mass quantities of PPE from everywhere we could find it, as I've been talking about, and we created a warehouse of personal protective equipment and pandemic-related supplies in that warehouse. Now, it was such a fortunate event to have this space. The fact that the timing lined up when it did, we'd love to step back and go, oh yeah, we planned that. It really was just a fortunate event, and you should have seen it. And I probably should have thrown pictures in here. Just aisles and aisles stacked 15 feet high of gowns and masks and gloves, and just from all over the world. And the supply chain staff would come in, would just staff it, folks who had never worked in a warehouse before. We had to create an inventory system to keep track of this stuff. We had to have nurses on site to vet these things. We had to send products to a third party, just to make sure that when you ordered an N95 mask from some random vendor in China you've never heard before, that it actually was an N95 mask. And a lot of them we'd send back and it'd come back, N57, because it didn't actually filter out 95% of particles. So it really was a very fortunate event to have this warehouse space, and it's really what allowed us to weather the pandemic, because it did go on for quite a while, and really be successful throughout the whole thing. We never ran out of anything. Now, at the time, there were some news reports and whatnot about people complaining in the healthcare system, saying that they quote unquote didn't have what they needed. You got to kind of take a step back from that a second and say, like, if I went to a place, an ice cream shop, and said I really want ice cream, and they came back and said, we've only got frozen yogurt left, and I walked out of there saying, can you believe it? They didn't have my dessert. Well, in times of crises, if you really, really needed that ice cream, you probably could live with the frozen yogurt. I think that's kind of a little bit more of what it was. We had, when you take a look at like the gold standard of things, like a 3M N95 mask, that's like, if you had your choice, that's the one you're going to get. But what we would have are some unbranded N95 masks. We'd have some masks that were like level 3 surgical masks, which were really, really good, but maybe not quite like I'm walking into a chemical weapon, a chemical bomb protection level. But as time went on and we started to learn more and more about the virus, a lot of these kind of like 1A options started to become a little more viable, because at first no one knew and said, I'm gonna contract this and die unless I have an N95 mask. And again, as time went on, you started to realize, okay, now we can use this mask. Now we can use this gown. We don't need a triple layer glove, because that's not how the virus was transmitting. And so it was very touch and go for a while, but we had to respond to it. And one of the things that made us very successful was we created our own MRP system. And this is something, again, that I credit my mentor in supply chain, Fred Foreman, who was an APIC speaker for the longest time. And he's the one who kind of taught me about an MRP system and what it could do for me. And we kind of created our own. I had an Excel guru that created this automated system, and it was really fantastic. And we did demand planning for the first time, because the health system right now, or the way that it would work normally, is you kind of have things that are pretty steady. You buy what you need, and then when it runs out, you replenish, kind of like a Kanban system. But to demand plan out based on a forecast, that's not something that we normally had to do. And when it came to this pandemic, and you see, okay, based on the number of cases there are today, we know that there's because if you remember, especially early on, there was a factor. It was a factor that said, based on this is how many people will get sick from those people. And then it kind of compounds from there until you hit a certain point, and then it starts to come back down again. So we could predict out where this was going to go, and had to, gauge what we were going to get. And a real eye-opening thing for somebody was that somebody would walk in and go, wow, we're in great shape. We've got 2 million N95 masks on order right now. And I'd say, that's fantastic. When are they coming in? Well, yeah, they're probably due by, next 30, 45 days. Okay, that's great. What are we going to do in between there when we have a need for 500,000 of them? So, and they'd say, oh, yeah, I guess you're right. You only know that if you have your numbers written out and says, I need 100,000 a month for the next 5 months, or whatever, 100,000 a week, for the next 5 weeks, and that's your demand. And I think what it allowed me as a supply chain manager to say to the staff, that's great, you've done a great job. And this is like in March or April of last year, May or June, Jim will thank you for that shipment when it comes in, but March and April, Jim needs you to go back out and find these things. And that's what they really did. They would call up, and I mentioned it down at the bottom here, that prices were sky high. What would happen is, obviously supply and demand, and then there was a whole lot of price gouging going on, which, the government eventually kind of looked into, and probably with varying degrees of success. But someone would run into my office. I mean, literally run in anytime, day or night, because we worked ridiculous hours at this point, and say, Jim, I just got off the phone with somebody. He's got 150,000 3M N95 masks sitting in a warehouse in New Jersey. He needs cash right now, and he can have them here tomorrow morning. It's like, I just fully expected for them to send a picture of them holding a mask in today's newspaper to prove that they were real. And it's one of those things where we didn't have a choice. And I'd say, well, how much does he want for them? Oh, yeah, they're $7 a piece. $7 a piece, and each person is using 60 per day. But what are you going to do? Does he have them? Yes. Okay, we can get him here tomorrow. Yes. And that whatever 150,000 gets us through for the next week and a half. Yes. Light it up. And we'd go and write ourselves a, whatever, $700,000 PO just like that. That's the way that it was for a few weeks. It was really that crazy. The amount of money that went out the door, millions of dollars went out the door. And with the idea that FEMA would eventually reimburse some of this stuff. But it was really difficult to deal with that type of price gouging. But I do look back with a lot of respect for those who worked around me, who gave me the leverage and leeway to say, okay, if you think we should get this, just do it, and go and do it, and we'll figure out how to pay for it later. And that's what we did. That's what we had to do to get by. And we did, and we're successful. And for that, I wouldn't go back and change anything about our response. So now that we've, entered a new era here, hopefully the worst of everything is behind us and we've got brighter days ahead. What are our options now that we can kind of do I don't want to say a post-mortem, because that obviously is in poor taste, but I will say, just look back on what we've been through over the past 14 months. And one of the things that we've considered doing is potentially making our own PPE, actually going to manufacturers that we hire and we do the quality control of and get samples and test and everything, and then contracting to have this stuff made, so that when something happens again, and unfortunately it will, it's not going to be another 100 years like it was since the last one. The world is so mobile now, and things spread so easily, as we saw with this particular virus, that it's only a matter of time before something happens again. So we want to move to a place where we can have a pipeline of things that we can call our own, whether we private label, private brand it, whatever the case is. It's an option on the table for us that never really was an option before, because we didn't have the need. One of the things that we can actually do to make this a reality is work with our group purchasing organization. We're a Vizient member on a national level and a Northeast Purchasing Coalition member on a more regional level. But we can work with the GPO to have a stockpile to draw from. And to me, that's a fantastic idea. And I think for any folks who work with their businesses that they work with GPOs, I think that, to me, is a brilliant idea for GPOs to start pitching as a reason to have people join their GPO and stay with it. Because if a GPO said to me in our health system, hey, join us, and then the next time one of these things happens, you're going to have a stockpile that, as an A member or a B member, whatever the membership level is, you're going to have this to draw from, and we have a pipeline and a manufacturer that makes this stuff for us. So you don't have to go through all of that. It takes away that anxiety of not knowing where your next supply is coming from. I think that would be really great. And then shoring up agreements with vendors to keep extra on hand or allocated in case of emergency. And I put down here, we found out who our real partners are. And what I mean by that is every vendor we work with wants to say that they're our partner. They love that word. We're your partner. I laugh now, and I've thrown this back in their faces multiple times, because they say, oh yeah, we're your partner. Where were you when we needed beds, when we ran out of them? Where were you when we needed ventilators? And you came back to us and said, well, you don't have any on order. This place in rural Wyoming has 5 of them on order. So, you kind of have to move to the back of the line, and it'll be 6 months. I'm sorry. Wouldn't a partner in that case maybe talk to that other health system where they don't have any coronavirus cases for the next 3 months, and maybe allocate that demand to where it's actually needed right now to save lives? I'm not saying it's necessary. I'm not saying it's even expected. But if you're going to throw that word partner around, these are the types of things that we really want to start building into the contracts that we write, into the really into the agreements that we make with the vendors we decide to partner with. I think with a pandemic like this, the way that it worked out, everybody will probably remember that it wasn't a, snap your fingers, the entire country has it. It was New York was crazy and like really, really crazy for a while. And then I think it went down to Florida, was the next big hot spot. And then it was Los Angeles was a big hot spot. And then eventually it reached more of the Central America area. And then it's kind of stayed there as time has gone on. And I think to me, that the bottom line there is that you really did let us know who our real partners were. And some of them were very good and really did step up, but some of them did not when we really needed them to. And then finally, securing additional warehouse space for pandemic supplies. So, we had this warehouse. It was great to have it when we had it. It was really the biggest advantage we had throughout this whole process. We didn't have to go find warehouse space. We didn't have to spend additional money because we already owned the building and it was brand new. It really just was the biggest advantage. But now that warehouse is made up, is filled with our normal med surg supplies and is run by our medical surgical distributor, Medline. So they're working out of that space. We can't use that space. If another pandemic happened right now, we wouldn't have a warehouse to go to. So we're actually sourcing additional warehouse space for pandemic supplies and to keep kind of something in our back pocket so that if something, even if it doesn't hit the levels of the COVID-19 pandemic, again, we'd still have something to draw from and a place to go to keep supplies and to run a supply chain operation out of, if we really needed to. So I just talked everybody's ear off for a good 20 minutes or, well, more than that. Good Lord. Well, I thank you for paying attention and am happy to answer any questions that you may have. And thank you for your time.
If you have any questions, unmute yourself. We have from Robert, have prices begin to come down?
Yes, on personal protective equipment, it has, and the demand has gone down significantly because it's not being used in every single procedure like it was. Now they're still using them, but these days, a standard blue surgical mask can be used instead of an N95 mask. So while the prices are still relatively high on the N95s, they're about half of their peak now. They're more than they should be. They're probably a good 4 or 5 times higher than they originally were, but still half of what they went up to, which lets you know how ridiculous it really got. And I think one of the main things that we've seen is that the rapid testing has been a huge help because now folks and vaccinations, obviously that's the biggest thing, where folks don't feel like they have to wear a hazmat suit to go treat a patient. I think there's still ways to go. Like when I went to an ear, nose, and throat, and you see me keep playing with my nose because these allergies are killing me. So I went to an ear, nose, and throat doctor a couple of weeks ago, and I've been vaccinated for months. So thankfully, I was lucky enough to be in the I work for the health system and got vaccinated very early. But I've been vaccinated for months, and I go into the place, and it's an ear, nose, and throat doctor. They have to see my nose and throat, and they still made me, fully mask up, stay fully mask. Everybody's there is mask, face shields, the whole thing. They only let me pull my mask down below my nose. There's still and obviously they're all vaccinated too, but there's still this kind of lingering thing that says, oh, we're going to be in danger. And so I think that's the reason why we haven't seen it go back completely to normal yet. And it's probably going to be a while until then.
Another question, is Yale going to invest in an actual MRP system?
Yeah, that would be nice. I would say that that the only reason why they wouldn't at this point is because of the fact that it's hard to describe. I would love it, first of all. I'm a big MRP guy. But traditionally at Yale New Haven Health and at a lot of health systems, the demand that comes in is really more reactionary than forecasting. And I think you need the MRP system to really help you forecast. And while you can see far out in the future, we never were really buying things in batches like that. So like when I used to work at the cosmetics company, I used to order their components. So, we'd order jars from China or batches of labels and containers and whatnot and cartons. And, you'd get 10,000 jars in and you'd know, okay, I use 2,000 a week and that's going to, last me 5 weeks. So you'd get 10,000 jars in every 5 weeks. That was the way we did it. And you needed the MRP system to kind of help out, map all that out and aggregate the demand from all of our product line. Because of the way that we get our products distributed from our main med-surg distributor, they're the ones who handle that side of it. They take our usage demand and it's up to them to provide us the items that we need in that just-in-time manner. So it's actually not really necessary for Yale New Haven to have the MRP system, because that's left up to our distributor who buys all of the supplies from many different hospitals and then distributes those supplies to us as needed based on our demand. So I hope I explained it well enough, but that's kind of where we're at.
Next question. How big has your supply chain team grown since you started?
Since I started, it's definitely grown, probably, I don't know, maybe 25%. So it's grown fairly significantly. When I first started, there were actually two groups. There was, supply chain at Yale New Haven Health is huge. There's hundreds of people. It's probably about 500 people, because you got to think there's people that are materials handlers that are bringing things up to and from places, and warehouse folks and whatnot. But in corporate supply chain where I sit, we had a few arms. We have a supply chain analytics department that handles all of our number running and whatnot. We have a supply chain value analysis group, which is made up of usually kind of like semi-retired nurses that give us a clinical background to evaluate products. But then we also have, in addition to materials management, we used to have corporate contracting and procurement. My group was procurement. I had up to 24 direct reports at a time, which wasn't fun. But we had that group, and then we had corporate contracting, which was another 10 or 15 people. That's where the biggest gains have been. The corporate contracting group has grown to maybe about 25 people now, and we've sandwiched them on top of one another. So, and split it out then, instead of by contracting and procurement, we split it out by service line. So there's a clinical group that has both contracting and procurement. There's a non-clinical and pharmacy, and then there's my team, which is facilities and capital.
Another question. Can you quickly describe the purchasing procurement process supply chain for your healthcare industry for those not in healthcare?
Sure, absolutely. I don't know if I can do it quickly, but I'll try. In the way that it works, best I can boil it down. So we have a few ways of doing things. We have PAR systems that are in all of our stock rooms that are, weighted bins and everything, where they're automatically replenished on a daily basis from our med-surg distributor that sends in totes that are then brought up and then put into all the supply slots. That's a little out of my area. I don't really deal with that a lot anymore, being out of the procurement group now. For capital procurement, that's done kind of a different way, where capital funds and projects are approved and then requisitions are written to draw down from that approved funds, kind of like a checking account. For everything else, the way it works is that end users throughout the health system, and there are thousands and thousands of them, they go and write requisitions in our ERP system, which we use Infor Cloud Suite. We were the first major health system in the country to use a cloud-based ERP system like that. And not to say that it's a good system or anything, I'm not a big fan, but then again, I came from Microsoft Great Plains, so there can always be worse. So and the way that works is that they go in and either write a requisition based on something that has an item number in our system that has contracted pricing and terms and everything set for it, or they can go and requisition something that that is kind of like a free-form item. We call them X items, and kind of just request whatever they want. From there, it goes through a dollar threshold approval level for department owners and cost center owners. And then from there, it pops into a buyer's queue. The buyers are assigned cost centers, usually by service line. So we'll have like an OR buyer, we'll have a purchase services buyer, and so on. And the buyers work their queues. For the most part, they're just trying to ensure that pricing is accurate, that unit of measure is accurate. They do their order confirmations once they send the orders out, either through EDI or through email. And the only difference with the capital procurement process is there's a step to benchmark quotes once we get them in and do price negotiations at that point.
Okay, one last. Well, I don't know if it's very last because they keep showing up. Could you tell us more about PPE being taken by the government once arrived in the U.S.?
Yeah, so I think it was, and I probably shouldn't be so broad about that statement. I think what it was is that the government just was taking a look at everything that was coming into the country because of some of the sanctions that were put through. And so, things just took forever. The government had to go through everything that was coming into the country at that time. There were times where things would come in and we would never get access to them. I don't know where they went, but I know they arrived and they went into a port, and that was the last time anybody ever heard of them. I think, and it was for a very short amount of time. So, I probably should backtrack a little bit on that and say, I don't know enough about the particulars about all that to really make a statement like I made earlier. But to say that I just know that the government was involved in every shipment that was coming in. And at times it really did seem to either delay or permanently delay our shipments.
Okay, one last, this is an interesting one for you. For a supply chain student, what advice would you give that you felt helped you most do your job?
Most do my job? I think it would be, it's going to sound funny, the advice was listening to the advice that I was given from those who had came before me. And so I am a big believer in not making the mistakes other people already made. I never was that type that needed to learn it on my own. I was just always the type that liked to surround myself with good, knowledgeable people. So the best thing I ever did was to heed the advice of the supply chain professionals who had been doing it for so long above me, that said, you're doing a great job. I think that while people know you and know your talents here in this organization, your resume is going to show that you work for a mid-sized cosmetic company as a planner, buyer, and a supply chain manager for 7 years. That might not tell them everything they need to know about you. So they suggested that I go and get my APIC certification, and I did, and it was the best thing I've done for my career. I can just plainly say it just like that. And I honestly, if I thought I knew better, and I thought that I just based on my merits alone that I could get to where I wanted to go, it never would have happened. So really just listening to the advice of those who are willing to give it to me, from those who were in positions that I wanted to be in at some point, that was very helpful to me.
And the last one, how has the electronic chip shortage affected your organization in getting the needed medical equipment?
Medical equipment hasn't hit us yet, and and it's actually a pretty funny reason why. That's because we're not buying anything right now. When the pandemic made Yale New Haven Health lose money for the first time in 50 years, the first thing to go was capital spend. which was just fantastic because I literally was put in charge of a group in charge of capital spend at that time. So it was kind of like, uh-oh, what do we do now? And we've only been buying absolute emergency replacement items since then. So so it hasn't hit us in that way yet, because we haven't been spending money replacing. We've just kind of been repairing items as they break, and kind of stringing along until the capital funds start flowing again. Where I will say it's starting to affect us is on the shift to work from home, because now Yale New Haven Health is moving to, for support functions like mine and for HR, IT, and whatnot. It's more permanent now, which I love, but it's more permanent being almost either remote all the time or almost all remote. And they're trying to provide for folks to work remotely. And it's very difficult to get some, laptops and various other peripherals that are needed. So that's how it's affected us so far.
Great. Okay, thank you very much, Jim. On behalf of the ASCM New Haven chapter, a donation will be made to the ASCM Supply Chain Council in your name in honor of tonight's presentation.
Fantastic.
Do you have a PDF copy you could send me so I could distribute?
Absolutely, yes. And
Great.
please, I'd love to talk to anybody here and connect, just in general. It's happy to be part of the supply chain community. And again, really appreciate the opportunity to do this. And I hope it was enlightening for some of you. And thanks again.